Okay, so today we're going to talk about something that affects millions of people, but is so often wrapped up in silence. We're talking about birth trauma and postpartum depression, and we're going to explore it through the really powerful story of author Sarah Hoover, who felt completely broken by an experience that, society tells us is supposed to be the most blissful moment of your life.
And just to get a sense of the scale here, let's start with this number, 1 in 7. That's how many women will experience postpartum depression. This is not some rare thing, it's not a personal failing, it is a very common medical condition that we are just not talking about enough.
And that number, it translates into this really profound, personal kind of suffering. When Sarah Hoover felt nothing but detachment from her newborn son, these were her words. She truly believed that good mothers just didn't feel this way, and that thought alone just sent her down the spiral of shame and total isolation.
So, how did she get to that point? Well, Sarah's journey into that darkness really began with her first birth. It was an experience that was the absolute opposite of the beautiful, magical event she had been taught to expect her whole life.
So she was unexpectedly induced, which already had her terrified. And then came this one pivotal moment. The doctor used what looked to Sarah like a long metal hook to break her water. And for her, the procedure was excruciatingly painful. She screamed, she cried out.
And the response she got, it was just devastating. Instead of any kind of empathy, the doctor dismissed her pain with this comment. In that single instant, Sarah felt completely gaslit. She realized her emotional well-being was just not a priority in that room at all.
The effect of that moment was immediate, and honestly, catastrophic. The physical pain, the emotional dismissal, it triggered her past experiences with sexual assault. She felt like she had to just shut down emotionally to survive the whole thing. So when her son was finally placed on her chest, she wasn't ready to fall in love. She just felt nothing.
That initial trauma plunged Sarah into a year-long battle with postpartum depression. It was an illness that was as confusing as it was debilitating, and it just kept building into this much, much larger crisis for her.
So what is PPD exactly?
Well, it's a mood disorder that goes way beyond the baby blues that a lot of new moms experience. We're talking about severe symptoms, anxiety, irritability, detachment, that can stick around for months or even longer if it's not treated.
And this is why PPD can be so tricky to figure out on your own. Sarah's symptoms didn't look like the stereotype of a new mom who's just crying all the time. For her, it was rage, it was intense irritation, even hating her husband. And this profound feeling of having zero connection to her baby, just feeling dead inside. She had these terrifying, intrusive nightmares. And because her own experience didn't match what she thought PPD was, she felt like a total imposter in her own illness.
Which brings us to a pretty staggering fact. According to Dr. Aliabadi, who's cited in the source material, a full 50% of women suffering from PPD are never diagnosed. Half. So what's going on here? Why is this happening?
Well, there are a few really powerful forces at play. You've got this immense shame that keeps women quiet. You have that exact stereotype mismatch that Sarah went through. And then there's just a simple lack of awareness. But, and this is critical, a lot of doctors just aren't proactively asking the right questions during those postpartum checkups. So after a year of suffering in silence, convinced she had to just fix it herself, Sarah hit a breaking point. And the turning point came from a place she never expected, a totally routine checkup with her general practitioner.
I mean, by this point, things were really dark. Sarah was having thoughts about ending her own life. She was looking out her apartment window, thinking about how messy it would be for her husband. A few days later, she went to her GP for a yearly exam, not expecting anything at all to change. But this doctor, she did something different. She actually listened. After asking about Sarah's relationship with her husband and her son, she just looked her dead in the eyes and said these words. It was the very first time someone had truly seen the depth of her struggle and called it what it was, a crisis.
And that moment of finally being seen, it set her on a clear path to getting better. First, she had to acknowledge the crisis herself. Then, she found a therapist she could really be honest with. And finally, she managed to overcome this intense stigma she had against medication and filled a prescription for Zoloft, which she said was literally life-changing.
After years of intensive therapy, Sarah felt healed enough to try for a second child. But this time was going to be different. She was determined to rewrite the script. She was going to use the trauma of her past to advocate for a completely different future.
And the contrast between her two experiences is it's like night and day. Her first birth was all about trauma and dismissal, and it led straight to PPD. Her second, it was empowering, it was supportive, and it led not just to a healthy baby, but to her own healing. The outcome was completely different because the entire approach was different.
So how'd she do it? She took control. She actually interviewed multiple doctors until she found one who was willing to work with her. She hired a doula for extra support, and this is so important. She created scripts for herself to state her needs clearly. She practiced them in the mirror so she could say them in the hospital. Simple things, right? Like, ask me before you touch me.
You know, it really all comes down to the provider's approach. When you have unsupportive care, pain gets dismissed, and that leads to a super high risk for trauma and PPD. But supportive care? That's when they listen, they respect you, they proactively manage your pain, and that creates the potential for a positive, even a healing experience. The difference is just stark.
And the result for Sarah was just profound. She describes her second birth not as something to just survive, but as this beautiful, spiritual, and miraculous day. She was surrounded by a supportive, all-female team, and she finally got the birth she deserved. And in a way, it helped heal the wounds from the first one.
I think the ultimate takeaway from her entire journey is this really powerful truth. As much as we wish the system would just automatically protect us, the reality is, a lot of the time, we have to be our own fiercest advocates. Learning to find her voice and actually use it was the key to Sarah changing her own outcome.
And that leaves us with a final, really crucial question to think about. Sarah's story is a story of triumph, but she had to fight for it. So if giving birth is one of the most fundamental human experiences on the planet, why does making sure it's a safe and respectful one so often feel like a battle?